Hey everyone, so this is part 16, that is last part of Anesthesia series. Now we'll be talking about neonatal resuscitation protocol. So in this we have neonate. So we'll be doing antenatal counseling first. Then we'll have all the equipment check. Now after birth immediately there will be cord management, like cord milking, clamping and all. We'll be talking about it in like in 2 minutes or something. So we'll have to check term, tone, and cry of the baby. So this is how we'll be checking that baby's condition, and then we'll warm the baby, we'll dry, we'll position, and we'll clear airway by suction, and then check for apnea or gasping and heart rate, whether it is less than 100 or not. If yes, then you'll have to do intubation or laryngeal mask and monitor the cardiac thing. If it is still less than 60 beats per minute, then you'll have to start giving 3s to 1 ventilation, compression, and all. Then 100% oxygen has to be given and UVC has to be given. If it is still less than 60, then consider other causes like hypovolemia and pneumothorax. So this is how you will deal. Now target oxygen saturation table is also there, wherein after birth in 2 minutes we will need 65 to 70% saturation, and after 10 minutes it has to be 85 to 95% approximately. So 3 minute, 4 minute, 5 minute, it has to increase by 75, 80 and 85. So 5. It has to be 85 to 95% by the end of 10 minutes. Now we'll have to do suction also sometimes. So what is the order of suction you will do in a newborn? It is basically mouth followed by nose, because they'll be breathing mostly with mouth. So order of suction will be mouth followed by nose. Then temperature of the room has to be 25 degrees Celsius. This is a very important point. So temperature has to be 25 degrees. Then you will have to do delayed cord clamping and cord milking has to be done. Cord milking has to be non-vigorous and has to be done in 35 to 42 weeks old baby. Delayed cord clamping has to be done in stable term or preterm at least for 60 seconds. This is important. So duration is 60 seconds. Now coming to bag and mask ventilation. So when you will have to start within 1 minute, and saturation if baby is greater than 35 weeks 21, 30 to 24, then 21 to 30, then less than 32 will have to achieve greater than 30%. Now respiratory rate should be 30 to 60 beats per minute, and contraindications will be congenital diaphragmatic hernia and tracheoesophageal fistula. So meconium stain liquor is not a contraindication, just remember it. Now saturation monitoring is done at a right upper limb. So it is done at right upper limb. Now chest compressions, you will use two thumbs. You will go 1/3 depth, lower sternum and of AP diameter, and this is the ratio. So it is 3:1. CC to PP base 3:1. So this is all you have to know about anesthesia. And one more point is Mr. Sopa. Just remember it. So what are important for proper ventilation? So mask adjustment, then repositioning airway, then suction of everything, open mouth and positioning and pressure. So these are the things that you require for proper ventilation and all. So thank you.